I'd like to call this meeting, of the Alexander County Board of Commissioners, into session. This is the 10th day of May, 2021. And at this time, I'd like to call on Vice Chairman Reese, who will lead us in the invocation, and then Commissioner Josh Lael will lead us in the Pledge of Allegiance. If you would, please rise.
Let us pray. Father, we come to you today, and we're thankful for the blessings of this day. Lord, give us the wisdom as we go through this meeting tonight that we do things that would move Alexander County forward. Pray a blessing over all our citizens of the county, all our emergency services, all those who work daily, putting themselves on the line to protect us each day. Thank you for them. Give us wisdom as we go through the meeting. Keep us safe as we travel to our homes after the meeting's over. And we ask all this in your name. Amen.
Amen.
Join me in the pledge, please. Attention, salute, pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. You may be seated. At this time, I'd ask if any commissioner had any reports.
Yes, sir, Mr. Chairman. I was at the library board a little while ago, and regular library programming will resume June 1st. There are people going in now, certainly with some protocol, but regular programming resumes June 1st. And a summer reading program that's going to be really exciting. Watch for more information. It'll also kick off on June 1st, and there will be plenty of announcements about that for the kids this summer. So hopefully the library will be hopping back like normal here before long.
Very good. Anyone else?
Mr. Chairman, I was able to attend the National Day of Prayer at the courthouse on Saturday. Good crowd there and a lot of people there. And kind of got me the title thing here. I'll just read it of the main scripture they were talking about. Now the Lord is the Spirit, and where the Spirit of the Lord is, there is liberty. 2 Chronicles 3:17. You know, that's a good thing. We need to pray, and we're in some of the craziest times, seemingly, that I've ever experienced. Never thought to experience it, but you know, maybe we can start to see the light at the end of the tunnel.
For sure.
But thanks, sir.
Anyone else? All right. Thank you, gentlemen. At this time, I'd like to make a motion to approve the agenda with the exception of item number 4. I would like to table item number 4 until the next meeting. And with that, the agenda as is. I'll make that in the form of a motion.
Second the motion.
Any discussion? There being none, all those in favor indicate by raising your right hand. Those opposed likewise, the motion carries. Thank you very much, gentlemen. Public comment. I believe we only have one person to speak tonight. Is that right? And I think you're going to read that. Is that correct? Yes. Thank you very much, ma'am.
Thank you, Chairman and board members. These comments were submitted by Craig McLeod, and Chad is also going to show some photos that Mr. McLeod submitted last week while I read his statement. Good evening, Commissioners. Once again, the McLeods need to go over the ongoing issues on Ridley Ranch Road, where the McLeods own 110 acres. The McLeods have requested assistance multiple times in person at these meetings, and emails have provided photos of violations of Alexander County's codes and ordinances. These issues have been ongoing since September 2019, approximately 18 months. The Martha Webster property still has not been cleaned up at all. Household garbage, junk, trash, tires, car parts still exist. Also now, Frankie Drum, the adjoining property owner, has moved a junked-out large boat she owns, per year's past photos, and miscellaneous trash, including more junk, onto the abandoned Webster property. This property needs to be condemned. The Drum property still has a junked-out travel trailer along with other miscellaneous junk along the roadside that the county stated would be removed early last year, but this has not happened. Please review the photos yet again. When the commissioners and the county do its job, when will the county commissioners and the county do its job to correct these violations on Ridley Ranch Road? You are not enforcing the law. More junk and trash continues to accumulate on these properties and others on Ridley Ranch Road due to the county's lack of action. Also, the right-of-way must remain clear of vehicles and debris for ingress and egress for emergency responders and other property owners along Ridley Ranch Road.
Thank you. Item number 3, National EMS Week, public hearing, approval of road names Boatwright Drive and Rita Lane. Mr. Rick French, County Manager. As this is a public hearing, I'd make a motion to open the public hearing at this time.
Second.
Motion is made and second. Any discussion? There being none, all in favor indicate by raising your right hand. Those opposed likewise, motion carries. Thank you, gentlemen. Mr. French?
Thank you, Mr. Chairman. Staff requests the approval of the following road names as listed below. Names meet regulations as required. Names have been checked for duplication and sound indexing. The road name is Boatwright Drive. Location is Cross Street on Pisgah Road, and road name is Rita Lane, Cross Street of Country Road. A petition has also been submitted to rename the following road, Wyke and Parks Lane, to Israel Hill Way. These names also meet regulations as required. Be glad to try to answer any questions about the roads.
Very good. Anyone have any questions? As this is a public hearing, anyone in the audience who has a reason to speak at this time has the opportunity to do so.
Did the first two roads have a name before?
I'm assuming they did not.
Just a state road number?
Yes.
All right, I'd entertain a motion to close the public hearing.
Make a motion to close public hearing for road names.
Do I have a second?
Second.
Motion is made and second to close the public hearing. Any further discussion? There being none, all those in favor indicate by raising your right hand. Those opposed likewise, the motion carries. Gentlemen, what's your favor?
I make a motion to amend the roads to Boatwright Drive, Retta Lane, and Israel Hill Way as stated in the recommendation.
Motion's made. Is there a second?
Second.
Motion's made and second. Any discussion? All those in favor indicate by raising your right hand. Those opposed likewise, the motion carries. Thank you very much, Mr. French. Item number 3, National EMS Week Proclamation. Mr. Doug Gillespie, Director of Emergency Services.
Thank you, Mr. Chairman, and thank you, Commissioners, for allowing me the time to talk here. Starting May 16th through May 22nd is considered National EMS Week, and yearly we do a proclamation for EMS Week. And I'm just going to read it to you real quick. Whereas emergency medical services is a vital public service, and whereas the members of the emergency medical service team are ready to provide life-saving care to those in need 24 hours a day, 7 days a week. Whereas access to quality emergency care dramatically improves the survival and the recovery rate of those who experience sudden illness or injury. Whereas the emergency medical service consists of emergency physicians, emergency nurses, emergency medical technicians, paramedics, firefighters, educators, administrators, and others. The members of the emergency medical team, whether career or volunteer, engage in thousands of hours of specialized training and continuing education to enhance their life-saving skills. Whereas it is appropriate to recognize the value and the accomplishments of the emergency medical services provided by providers by designated Emergency Medical Services Week. And it just goes on, it says, now therefore I, Larry Yoder, Chairman of the Alexander County Board of Commissioners, Taylorsville, North Carolina, in recognition of the event, do hereby proclaim the week of May 16th through the 22nd, 2021, as EMS Service Week. And the slogan this year is EMS Strong, Caring for Our Communities. And I think that plays a big role with what we've seen with the pandemic that we're going through. We do care for our communities, and we do work hard for our citizens and anybody that visits the county. If there's any other questions, I'll be glad to answer them.
Anyone have any questions? There being none, I think it's great anytime we can recognize our emergency service personnel, Doug. We appreciate what you guys do, and you do an outstanding job in Alexander County. I'd entertain a motion to approve the proclamation.
Make a motion to approve the proclamation.
Second that motion and love the theme.
Me too. I like that. Yes. As the motion is made and second, any discussion? Those in favor indicate by raising your right hand. Those opposed likewise, the motion carries.
Thank you for your time.
Thank you, sir.
Thanks.
Item number 5, board appointments and reappointments. Mr. French, County Manager.
Thank you again, Mr. Chairman. Appointments to for code enforcement officers, appoint Cody Bowers and Bill Rogers, and appoint Eleanor Mallard for a 3-year term for the Library Board of Trustees.
All right, thank you, sir.
Yes, sir.
The recommendation has been made to you. Do we have a motion to approve?
Mr. Chairman, I make a motion to approve the board appointments and reappointments as stated.
Motion's been made. Is there a second?
Second.
Motion's made and second. Any further discussion? There being none, all those in favor indicate by raising your right hand. Those opposed likewise, the motion carries. Thank you very much. Thank you, Mr. French.
Thank you, sir.
And item number 6, Alexander County 2021-2022 budget message from Mr. Rick French, County Manager.
Thank you again, Mr. Chairman. The proposed general fund budget for Alexander County for fiscal year 2021-2022 totals $45,598,762. Requests from county departments for the upcoming budget year totaled $48,009,438. The original general fund budget for 2020 and 2021 fiscal year totaled $42,892,442. Currently, the revised budget for this fiscal year stands at $49,082,437. There is no property tax increase proposed in the budget, in the 21-22 budget. The recommended general fund budget for 21-22 includes the following major items: new vehicles and with equipment for the Sheriff's Department, $230,000. Ambulance box on a new chassis, EMS, $100,000. Installing HVAC at Evidence Storage Building for the Sheriff's Department, $100,000. And then I'd like to ask Greg Cronk to step forward and give you an idea about the next item, Lenny's Mountain Tower upgrades and the core network routing switches in both county data centers. I'd like for him to address that.
Thank you.
Greg?
As a part of the Information Technology Department's proposed FY 21 and 22 budget request, we had 3 capital items for you. I think Mr. French wanted me to highlight those. One was an upgrade on our Lenny's Mountain Communication Tower. For those of you not aware, we have a 190-foot tower at the top of Lenny's Mountain. It is our primary public safety radio tower. As a part of a broadband project probably 2 years ago, we opened that up and allowed a private vendor to put some equipment on it to facilitate some additional broadband in the community. And at the time, we did a tower assessment using an engineer for that and came back that we were approximately about at load on certain components on that tower. Since then, we have approved, or this board has approved, first phase of an additional project which requires additional equipment on the tower. And so we had the same engineer take a look at that, and they look at it for a couple of different things. One is 120 mile an hour wind gust at so many seconds. Another is ice loading at a 30 mile an hour wind. I think it's 3/4 inch radial ice loading. And we identified a component on that tower with the additional equipment that's going to be added that would put that tower at 107% loading on certain parts of the legs of that tower. And so I think the industry standard or state standards now is anything above 105 you need to address. And so we have requested $40,000 to address that. The resolution for that would be them to come in and put some additional strengthening on certain parts of the legs. I think it's 20 to 60 foot sections of the legs. And I think they come in and probably put either an inch or an inch and a half rod on those legs and attach it, and mainly to keep it from twisting is the main concern. So we've asked for that funding, feel that that's probably something we need to do, since that's our primary communication site. Additionally, we asked for $15,000 for some additional licensing for an off-site backup disaster recovery. We implemented most of that project this fiscal year. We lease space in a nonprofit data center in the RTP area, and we have all of our off-site backup equipment there. And most recently, we put some additional equipment to be able to run mission-critical servers from down there in the event that, knock on wood, we hope we never have anything, but in the event of any type of cyber issue here or ransomware type issues, we can actually stand up what we term mission-critical servers down there and actually run them from that site. So that's additional licensing to complete that project. And finally, we asked for $90,000 to replace some core routers. We operate 2 core routers, one at our data center administration building, the other at our data center 911 center. And these are big pieces of equipment. They handle all of the network traffic across all of our, we have about 15 sites on fiber. They do all the key routing for that. From those routers, we deliver service to all the other county buildings. And we deliver at least gig connection to all buildings and all desktops, and we deliver 10 gig connections to the larger facilities and between our data centers. And the ones we have now are about 7 years old. We have had some recurring issues with those and have creatively fixed some of those issues. And so we feel it's probably appropriate to address those. These are things that run 24/7. All of our, we support 24/7 operations at Sheriff's Office and law enforcement and things like that, and especially our 911 center. And so we think these are pretty critical pieces of infrastructure. So with that, I'm happy to answer any questions you might have. Okay? Thank you.
Thank you very much.
Well, yeah, Greg, one question. If we add other phases of broadband, what impact will that have on that tower? If we do the fix that you said?
The upgrades we have planned for address both phases, phase 1 and phase 2 of your proposed broadband projects. If there are additional, we can probably accommodate those at this point on that tower. I believe that the loading comes down to under 90% in the affected areas. So we should have enough capacity for anything we would wish to add or they wish to add in the future. Okay?
Deal. Thank you.
Thank you.
Very good.
Other items in the budget, capital items, body cameras for Sheriff's Department, $87,570. We also have some new debt in the budget, new debt on the Bethlehem Sewer Project, which begins, the first payment begins November of 2021, $306,478. New debt on the county water project, which has already started, $316,243. Replacement of vehicles for Department of Social Services, $48,000. And as we talked about before, the COLA that was implemented in April of this year will have a $410,000 impact on the 21-22 budget. There's some new employees recommended, but at this time I'd like Doug Gillespie to step forward and talk about the 8 paramedics and also talk about the fee changes that are being recommended. Doug?
Thank you again for letting me speak. First of all, we'll start talking about the 8 paramedics, and we're not going to say paramedics at this time, but we'd like to try to get the 8 paramedics to provide another truck. Basically, what we need is the manpower itself. We already have everything else, so we're not going to have to buy a new ambulance, new cardiac monitor. We tried to get that at a new base. We're going to keep them up at Station 3 area right now. We're getting that back up and running. I've requested for just an extra $325,000 on the budget for that. And then, of course, with the insurance, the bonds, the taxes, and stuff on that, it increased it quite a bit. But I still only went up about a total of $328,000 to sort of offset some of that with some of the other equipment. And y'all purchased some new cardiac monitors, so that saved us quite a bit of money. My goal would be, once we get this started, to get them started about September or October, so that could save a little bit of funds also. I've also looked at our transport fees, and I compared them to other counties. Well, first of all, I compared them to Catawba, or all the surrounding counties, and I know that's hard to compare. But we haven't changed our transport fees since 2013. But I also compared them to counties that are similar to ours that we hear in the meetings and stuff, Davie County, Richmond County, Yadkin County. And you should have a list, hopefully they got a list of what we looked at in that situation. And basically, most fees only went up about $50 or so. There's a couple on mileage itself, and there's a couple at about $100 that it went up. So I recommend that we can offset some of that with an increase in our rate fees to help with putting that manpower on. Like I said, it's just the manpower I need. It's not the truck, it's not the base or anything like that, so there's no extra cost for that. We know at the new base, it could cost quite a bit to build, for getting the land and everything. Any questions on anything?
Yeah, go over this briefly, the fee structure here for me, just.
Okay, the fee structure, basically it breaks it down, and what I did is I worked with our billing company, and it breaks it down, and we worked together, and they gave us a recommendation, and most of their time their recommendation is anywhere from 100 to 150% more than what is considered Medicare allowable. And we didn't completely go with their recommendations. If you see, it's got the Medicare allowable, it's got the EMS/MC, and that's EMS Management Consultants, and then it's got our service with the recommended changes. You've got it broken down into different categories for where we transport a patient. If we're transporting a patient that's sick and not really injured, we don't have to do all the procedures, we don't have to do the oxygen and stuff like that. They're gonna get what they consider a non-BLS, non-emergency only. And at the current charge, we're charging $275, and I recommend we go up to $335 for this, or $325 for this. Like I said, most of them are about $50. When you go into your specialty cares, that's transporting patients with ventilators. The specialty cares is you usually have a lot of medications. You have to worry about the ventilator, how it's working and breathing for the patient. You have to tweak it, so it's usually a little bit more, $880, and we just went up $100 on that, and that's $980. So it breaks down into what services that you actually administer. If you administer certain drugs, it'll break it into the ALS emergency versus non-emergency. A chest pain call where we rapidly transport them to the hospital is considered a ALS emergency transport. So the current charge is $515, and we looked at $565. We do have what we call a dead on a scene, whereas right now we found out through our Mission Lifeline, where we got our Gold Plus last year, that doing CPR is what saves lives. First responders, our sheriff's department that have the AEDs and everything, but CPR is what we find saves lives. Well, back in a few years ago, and we won't say how many years, and that's going to give my age a little bit, it was pretty much you perform what we call monkey CPR. You hang on to the rails of the ambulance and you try to do CPR on that patient. Well, that was not circulating the blood proficiently, so the chance of survival was low in that situation. Now we do everything on scene. So we get efficient CPR where we're not moving around. We've got auto pulses that actually help and protect us and do consistent CPR, and we've seen an increase in survival because of this. And when I talk about survival, I'm talking about walking out of the hospital with no or minimum neuro deficits that they can live a productive life afterwards. So we've seen some of that. We look at things like that. That would be, we charge them only $325, and we're going to keep it at $325. We do have a public assist and repeated use, and we have a protocol set in our SOPs that if we go out to your residence 3 times in a week just for public assist, on the 4th time we will charge you. We do see some usage of that's, I guess, a little bit of an abuse to us to call us out there and they don't need anything, but maybe help getting up. Other counties are doing this, like I said, you look at it comparable. And then we have a treatment, no transport for $200 if we come out and give you check your heart, make sure you're not having a heart attack. We do have people that want to refuse treatment because they say, oh, I'm not having a heart attack. They just said that, so I don't want to go to the hospital. Or I want to go see my family doctor. Or I'm going to go see the urgent care. It might just be heartburn or something like that. Or if we give you medication, if you've got diabetic problems and your sugar's low, we're going to give you D50, glucagon, or something like that to give that to you to say, hey, this will get you through for a little bit, but you still need to eat, you still need to do something. Well, I don't want to go to the hospital. And we are seeing it with another problem that we're seeing now is opioid overdoses. Most opioid overdoses, we give a drug called Narcan. That Narcan is $100 and some a pop. It's the most expensive drug that we paid for this year. We give that to them, they become conscious, alert, and oriented, even though we know they possibly overdosed on an opioid. Either they did it on their own or they didn't mean to. If they're conscious and alert, we can't force them to go to the hospital. If we put them in the back of the ambulance and say, you're going to the hospital, and they say, no, I'm fine, we have a problem with assault and battery and possibly kidnapping. So they refuse treatment a lot. And we are seeing where we have to go out twice that day to give them more Narcan because they go back into an overdose state. And we're seeing that in other counties too. We're not as bad as other counties. We're still seeing methamphetamine as one of our biggest for overdose, but we are seeing an increase in opioid cases. Like I said, this should offset a little bit. The mileage has gone up, and the mileage has gone up from $9.25 to $11. And that's per loaded miles. And we look at the concept of the extra crew. And I pulled some data today for 2020, and I've got some data for 2021 or 2019. Alexander County EMS being unique. We do not have a hospital. I'm not saying we're the only county in North Carolina that doesn't have a hospital. They're all around. Davie County's starting to get some coming in closer to the Forsyth area. But we are with a patient on average 39 minutes. By the time you get on the scene and you first talk to that patient till we drop them off at the hospital, it's 39 minutes that we're dealing with the patient. Now, if that's a critical patient, think about that in the back. It puts a lot of pressure on us. Average calls or average time from the time we're dispatched to the time we check available back in the county is a little over an hour and a half. So that ambulance is tied up for an hour and a half. We're running on average 18 calls a day. Now, you know that you say that's not much, but that's 27 hours that ambulance is tied up if we transport. But we've had multiple days with over 30. We've had multiple days with over 40 that we're getting to. Single digits, we've had one last year that we had single digit calls in one day. Everything has been on an average of about 20, and that's transported calls. So we're with that patient for quite a bit. So we have to be good paramedics to actually work with that patient and deal with them and treat them the way they should be treated. And another unique situation being out of county again, North Carolina Office of Emergency Medical Services says you have to be back ready for service within 20 minutes of you dropping that patient off at the hospital. Certain hospitals take 15 to 20 minutes just for us to get the patient, if they're not critical, and put them onto their bed. And we still got 15 or 20 minutes to get back to the hospital. That's not time enough to go do what we need to do to get the stretcher ready, to make sure the equipment's ready. So when we do go back into the county, we are ready to respond to a calls. We're seeing a lot more of them responding from outside the county because they're closer, or that's the only truck we have. And we're still using the rescue squad quite a bit right now to put them as a backup unit. And the supervisor or myself actually gets on the truck and runs in with them as the paramedic itself. Limited amount of supplies. I don't carry everything that my ambulance does, but I can still run an ALS call with them. The supervisor's vehicle carries everything that an ambulance could want, except for the stretcher itself. So they bring all their gear, put them in the rescue squad truck, and then they'll transport with that. So that's one of the things we're trying to slow down. When we went to 4 trucks, we slowed it down tremendously, and now it's starting to rise back up because we're getting more calls. Last year we averaged, or in 2020, we did about 6,400 calls, in 2019 we did about 6,400 calls. In 2020, we've done about 69. We did have a lull during the pandemic state, March, April, May, because people didn't want to go to the hospital. But now they're ready to go back to the hospital, and they're calling us quite a bit. And we're on on progression to go to about 7,200 this year already with the data that I pulled.
So right now, if you have basic emergency transport, you're charging $435, the Medicare's paying $360 of that.
Yes, sir.
What's your success rate on collecting that balance?
Medicare is usually pretty good. They'll do contractual allowances. The only problem, we're collecting about 71% with the data I looked at today for the last 12 months, 71%.
Am I reading that right? And it says that Medicare will pay you $360? That
Yes.
leaves the balance for the patient to pay.
That is correct. Medicare does a contractual allowance though, and usually it's not charged. We just get what we get.
So what we're getting there is $360,
That's correct.
and we're not seeing that, the rest of that money.
No, sir. That's why ALS service will never be able to be funded by its bills. I hate to be mean. If you do a BLS service, which we don't have the number of BLS calls that we have to transport, say I need to transport my grandmother from the hospital to the doctor's, or from the house to the doctor's office. There is money there. You can make money from that, but ALS service will never make money. My goal in the future, and what I've done when I first took over as EMS director, is I want to at least get our salaries. Right now, we're looking at collecting about $1.2 million, which is about on average what we've had over the last couple of years. But with the fee change, I think we can get up to about $1.5 million. Now, Medicare will pay all the mileage as long as it's loaded miles.
So in what percentage, you may not know, but are a high portion of your bills Medicare liable bills?
I wouldn't say a high portion of Medicare. You got to look at Medicare and Medicaid. We get a lot of the Medicaid money, but we get it during what we call the ambulance cost assessment that I have to do every year. I'd say the highest is bill patient, and we're only getting about 7%, whereas Medicare we're getting about 80-some to 90-some%. Medicaid we get about 97%. Numbers are close; they're not dead on. And insurance bills we get probably about 60-some%.
Well,
So that gets us to that 70-some% that the county's getting from EMS management consultants.
You're getting a higher percentage of a lesser amount.
Yeah.
And then Medicaid, what's their charge?
Medicaid is a little finicky sometimes. They'll pay you a certain amount, and then when you do your cost or your ambulance cost settlement that we do every year, you'll get a lump sum. It'll look at, it's about 3 or 4 weeks worth of work for me to put in the data, the money that we use for supplies, the money we use for training, the money we use for equipment and stuff like that, the depreciation of ambulances. And usually we get about around $300,000. It's $265,000 to $300,000 a year. We get about 18 cents per mile that we do when you average out of our total mileage. So that's where a lot of the Medicare, you might not get as much up front, but during the cost settlement, you do get it towards the end.
But a Medicaid patient, what are they charged? $360?
Oh, yeah, they're still charged the same thing.
Okay.
And we're seeing nowadays that Medicare is not paying anything. I hate to be mean, but I've dealt with a lot of people in billing the last couple or few years that I've been at the EMS director, and I think sometimes Medicare just gets a handful and says, okay, we'll pay this one, we're not going to pay this 6. We have probably tripled our appeal rating, and if they come up and say, hey, they should have paid this bill, well, let me help you to see if we can appeal that Medicare decision that says that they don't deem it a medical necessity or ambulance was not needed. You can go in a vehicle and with a broken leg or a broken hip. So we have to work with the families to say, okay, this is the appeal process. I'll get you everything you need to do. You just got to come see me and we'll talk to Stripe. We get about 50-50 on that one.
Question, Doug.
Yes, sir.
How many ambulances do we run at a time?
4 ambulances and 1 quick response vehicle. This will be a 5th ambulance and still have 1 quick response vehicle, not including my personal vehicle that I have stuff in case we need it.
So we currently run 4 ambulances 24/7.
Yes, sir.
And how many paramedics is that?
Full-time, we have 39. That's including myself and my admin assistant, so about 37. 9 times 4. It's about 36, excuse me.
So if we have to transport different individuals out to different counties for hospital, and we're tying up ambulances, our county is approximately 264 square miles.
That's correct.
Population of close to 38,000, I'm assuming.
37.5 is what I seen on the last,
What does the state require or recommend per ambulances per population?
this was a question that we talked about, and we've talked about when Russell was here and everything, and it was always supposedly one ambulance for every 10,000 people, but there's nothing set in stone. We look at Davie County, and I look at counties that are comparable. Yes, I know Catawba County is next door and stuff. Davie County's been running 5 ALS ambulances for probably about 5 or 6 years.
In that response right there, did they even have that figured in of not having a hospital in the county?
Yeah, at that time they did.
Did they?
Because at the one point, everything was going to Baptist, just like everything to us, or Baptist or Forsyth, just like everything to us is going outside of county. We've got, the best place we go to is Iredell Memorial, then we go to Catawba Valley, and it's like 1,188 go to Iredell Memorial each year. 588 go to Fry Regional Medical Center, and about 700 and some go to Catawba County. And that's not including, we go to anywhere in surrounding counties. So we go to Iredell, we go to Davis, we go to Catawba, we go to Wilkes, and we go to Caldwell. And we can even go to Lake Norman because that's a surrounding county hospital. So if we go to Lake Norman, it's a lot longer for us to get there, and it's gonna be over. And that's on average a little over an hour and a half.
Base number 3, is that Sugarloaf?
Yes, sir.
And when do you expect to have that up?
We've been working with the schools, and as soon as I can get a truck back up and get that crew for it, we're going there. We've rearranged the districts. The call volume wasn't there as much as we wanted it to, and we were putting a burden on Station 1 where they were running all the calls. So we seen an influx of say, hey, I want to do this. So we've worked with that. Plus, we had some safety issues with COVID going on where there was a shower. We needed to add a shower. We also needed to work on laundry. To make sure the employees could do their laundry if they got contaminated. And so that was just been a process that we're working on. But the 5th truck, if possible, or not if possible, if we get it, we're gonna put it at Sugarloaf.
So bases 1 and 2 would have 2 ambulances, base 3.
Base at 1 would have 3 ambulances.
Okay.
They cover the majority of the population. Station 2, which is the Bethlehem, would have 1 ambulance, and then Station 3 would have 1 ambulance. And what that does with Station 3, that actually brings our coverage of what North Carolina EMS says we need to be there within 8 minutes on the scene from dispatch. That would bring our coverage from about 50-some% to almost 74%. And even in Catawba County, that's pretty good. In Iredell County, that's pretty good. But when you look at Davie County, when you look at Yadkin County and stuff, it'll be a little bit better, in my opinion. I haven't looked at those numbers, but it does show some better numbers.
Any other questions?
But I would just make one comment. I think, you know, the health, especially the emergency health of our citizens and our families, you know, is of utmost importance. And we have had to call and have an ambulance come to our house a couple times, and have always been very impressed. But, well, I don't say, there's not a but there. And I look at these fees, and I think compared to the outside world, they're very reasonable for what you're getting, If it's saving someone's life, I think $565 is a deal. When it may cost, I just had an MRI and it was $1,100. And my back is not life-threatening. It's just uncomfortable, so. I think you guys do a great job.
Thank you for that. Like I said, excuse me for interrupting. I've tried to put the numbers where we didn't ask for the whole amount. We've offset it with some of the stuff that we would usually buy, the cardiac monitors. We got those this year. So, you know, we just didn't go in and say, I want this much money for all this crew. I looked at it for probably 2 or 3 weeks and saying, okay, I can cut a little bit here to try to help out. I'm just not sitting here asking to say, hey, we want that 5th crew. We need that 5th crew. We do need that 5th crew, but I tried to work with the budget to try to help it out.
Well, and I can say, we had a situation with my son, he had a motorcycle incident, and anyway, Alexander County's responded and took him to Catawba Valley Medical Center. Well, they looked at, said he needed to be transported to a trauma center, Charlotte or Winston, and Catawba County did not have an ambulance available to take him. And that's a frustrating thing to hear when you're a parent and your child's hurt bad enough to need to go to a trauma center. And, they say, sorry, there are no ambulances available. And, we actually, gentleman, he's retired now, but, I knew the boss of the Caldwell County EMS and called him, and he said, we're in shift change. If we weren't in shift change, I could send one. And we called some guys we knew in Catawba County EMS and said, hey, is there anything you can do? There's nothing we can do. And we had to wait on an ambulance to come from Charlotte.
And see, even if we could, since it originated at Catawba Valley Medical Center, we would have to ask permission to come in.
Right.
And we would love to be able to take the patients to Baptist. We'd love to be able to take the patients to Charlotte. But you think about that hour and a half per
Oh,
call,
absolutely.
that goes up to 3 and 4 hours.
Yeah.
And there's only one time that we can go straight to Baptist, and that's for burn injuries, since they do have a burn facility there. But we're good to use the helicopter, the air medical when needed. One of the things we can say, our paramedics don't over triage. We just don't call a helicopter because we want to. And we work very closely with Air Care and Med Center Air to help with that. But Med Center Air's got their program, and they probably come up and guide him, and I know most of those guys, and they took probably real good care of him.
Oh, yeah. Well, and my point, or the point I was trying to make is, if someone is in need of, paramedics and an ambulance, and there's not one available, that's a problem. That's a problem. And so, I think we need to do everything we can to make sure that situation doesn't arise.
Well, it's not an issue for most people until they have to make the phone
Right.
call.
Yeah, it's not an issue until it's an issue, and that's what we look at. We're trying to prevent that issue. Like I said earlier, we're using the squad as the ambulance, backup ambulance, but that paramedic still has to be in the back. They still have to get all their equipment. I still get on the truck with them and run a call with them the other day to make sure that patient gets the best care. The rescue squad does a good job, but we got to remember their basic level and their volunteer, where we're a paramedic level. You go from 140 some hours to over 1,000 hours for training and stuff. So we try to limit it, but it happens. Our communication system is real good to go ahead and set the tones off 4 or 5 different times in about 10 minutes and make all the trucks disappear. We can't stop that, though.
I want to make sure you understood, my line of questioning and statements was only to paint the picture for everyone listening of just the vast area you guys cover, and proximity to bases and this and that.
You guys do a great job.
Yep.
We appreciate it.
And if I can answer any other questions, or you have any other questions, feel free to get a hold of me. I tried to get the data today that you might want. So, thank you.
Thank you, Doug.
Thank you, Doug.
As we were talking about earlier, there were 13 employees recommended. 8 of those were paramedics. 1 was an information technology employee. 1 was a garage employee. We currently have 1 full-time person at the garage. 1 is a full-time attorney. 1 is a reval data entry clerk, and 1 is a DSS income maintenance trainer / quality assurance supervisor. Couple other things to point out are that the City of Hickory is proposing a 3% water rate increase in the new budget. This is subject to approval by the City of Hickory Council. Water connection fees are reduced in June of 2019, and lower fees are in effect until January of 2022. We're proposing a $5 increase in both C&D and MSW fees for the landfill. This amount is needed because we're going to have to replace the floor in the transfer station. The transfer station was constructed in 96, 97, and it's the original floor, and it's really beat up from all the use. There have been no landfill fee increases for over 10 years. And would like to point out too that some of the items that we've told you about tonight may be eligible to be paid for out of the American Rescue Plan funds. The guidance is just coming out, so we're going to look at all that and we'll bring that back to you. But possibly some of the IT equipment and projects could be paid for out of those funds, just like new software for building inspections. And ambulance also might be eligible. They have a public safety factor in that too. The next step in our budget process is a public hearing, which is scheduled for May 24th at 6 o'clock here. And I have a number of other items that we have contracts for that for the new budget year need to discuss in closed session. I'll be glad to answer questions you might have at this point, but we'll go over it in more detail at our public hearing.
Any questions? Thank you very much, Mr. French. We appreciate it.
Yes, sir.
Item number 7, budget ordinance amendments number 78. Mr. French.
Thank you, Mr. Chairman. Budget amendment number 78 is to adjust the budgets of the water funds based on data from year-to-date revenue reports from the City of Hickory. And that's we come back to you from time to time for those adjustments. That's the only budget amendment we have tonight.
That's why it's suspended for a while.
I know, it is.
Entertain a motion on budget item number 78.
Mr. Chairman, I make a motion that we approve budget ordinance number 78.
The motion's been made. Do we have a second?
Second.
Motion's made and second. Any discussion? There being none, all those in favor indicate by raising your right hand. Those opposed likewise, the motion carries. Thank you, gentlemen. Other business, county manager's report, Mr. French?
Thank you, Mr. Chairman. The items I have are for closed session tonight, so we'll be bringing those to you in just a little bit.
Very good, sir. The consent agenda as presented there. I entertain a motion.
Make a motion to approve consent agenda as given.
Do we have a second?
Second.
Motion is made and seconded. Is there any discussion? There being none, all those in favor indicate raising your right hand. Those opposed likewise. The motion carries. We will have a closed session under North Carolina General Statutes 143-318.11, paragraph A, subsection 4, 5, and 6, economic development, contractual, and personnel reasons. And we will re-adjourn for the primary purpose of adjournment, and there will be no action taken after the closed session. I'll make a motion to approve. Do we have a second?
Second.
All those in favor? Those opposed likewise, the motion carries. We stand adjourned to close session.